When governmental public health faces dismantling and workforce disruption, what does it take to hold space for the next generation? On this episode, you'll hear how public health law shapes the field's foundation, why belonging matters for workforce performance, and what reimagining a new public health system could look like. You're listening to the PHEC podcast, episode 439. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guests and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I'm the founder of Dr. C.H. Huntley, LLC, which is a public health and epidemiology consulting firm specializing in strategic planning for organizations working to build healthier communities. We help leaders make sense of overwhelming information, figure out what matters most, and what to do about it. We partner with organizations addressing the root causes of poor health and putting communities first, and translating technical information into plain language. We respect the organization's history and culture while helping them move forward, build on what's already working rather than starting from scratch, and create plans that can actually be implemented. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes. I'm excited to introduce you to my guest on this episode. In this conversation, my guest shares how the 2025 challenges facing public health present an opportunity to reimagine the field's infrastructure and why law serves as both foundation and intervention for population health work, and how belonging principles can significantly increase workforce performance. From elementary school communication strategies to intergenerational collaboration, my guest offers a vision for protecting public health careers while rebuilding systems that center people over structures. Let me formally introduce her, and then I'll connect our conversation. Montrece McNeill Ransom, the founder and CEO of Empowerment Tour Coaching and Consulting Group, is a dynamic global keynote speaker and leadership coach dedicated to unlocking the power of human potential through belonging. An ICF-certified executive leadership coach and a DEI-certified belonging strategist, Montrece leverages over 20 years of expertise in public health, law, training, and workforce development. Her distinguished career includes 2 decades at the CDC, where she spearheaded groundbreaking public health law training and workforce initiatives. Montrece holds a Juris Doctor from the University of Alabama, a Master of Public Health from Emory University, and an Executive Leadership Coaching certification from Georgetown University. She has also completed advanced training in diversity, equity, inclusion, and facilitation. Recognized as an award-winning coach, speaker, and public health professional, Montrece was honored as one of Entrepreneur Mogul's top 5 most influential coaches of 2021, the ABA Health Law Section's 2019 Champion of Diversity and Inclusion, and the recipient of the American Public Health Association's 2017 Jennifer Robbins Award for the practice of public health law. Montrece also currently serves as the director of the National Coordinating Center for Public Health Training within the National Network of Public Health Institutes. She is the former president of the American Society of Law, Medicine, and Ethics, is a board member of Health Career Connections and the National Vaccine Law Association, and serves on the advisory committee for the Georgia Campaign for Adolescent Power and Potential. A prolific writer, she has authored or contributed to over 40 journal articles and is the co-editor of Public Health Law Concepts and Case Studies. Let's connect my conversation with Montrece right now. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. So today I am super excited. I say this every time, but I really mean it. I'm really excited to introduce you all to our guest on this episode. Montrece, welcome to the podcast. How are you today?
I am fabulous. Super excited to be here and chat with you. Very excited for this opportunity.
Yes, this has been a long time coming. I think for a while I had you on my radar. And then for a while I thought we'd already had you on the podcast. And I realized, no, she hasn't been here. So we had to get you. And then we had to get everything locked in and scheduled. But I am so glad that you're here and we're having this conversation today. We've been chatting a little bit before I hit record and just catching up on a few things. It's funny how we've been at the same conferences, and I think we've just kind of passed each other, not really been able to connect
Just passing in the night. Yes.
Right.
Yes.
I'm looking forward to that moment when we actually get to hug.
Yeah, there will be never a conference again where we don't hug each other.
That's
never
right.
Again.
That's right.
Never again, as of today.
That is awesome. So, and I'm definitely a big hugger. So I always tell people that when you see me come up to me, I'm going to hug you. So let me know if you need your space, because that's going to be my go-to.
Me too.
Well, let's start at the beginning. Why don't you take a moment, just introduce yourself to everyone, just a little bit about who you are and what you do.
Yeah, so my name is Montrece McNeill Ransom. By training, I'm a public health lawyer, and my work at this phase in my career really centers the public health workforce, doing training and workforce development. But, as most folks in public health, my career has not been linear. I started out in public health law, doing primarily legal preparedness work in CDC's public health law program. And then when I was given the opportunity, I was asked, what do you want to do? I said, I want to do training and workforce development in public health law. And my boss at the time was like, what's that? And I said, I don't know. But if you give me a desk and a computer and leave me alone for a little while, I'll figure it out. And so my last 10 years at CDC were focused on leading training and workforce development efforts, focused on public health law, teaching public health practitioners how to use law as a tool. And then when I left CDC, I did some coaching and consulting and was quickly recruited to the National Coordinating Center for Public Health Training, where I run a center where we really work with partners throughout the field to develop and deliver training to advance the public health workforce across a wide variety of areas, for sure. So I think of myself now as a public health law and policy expert that focuses on workforce development.
Oh, I love that. We're definitely going to dive into that because I'm making notes already. Before we do, though, I always love to kind of go back a little bit and learn about the journey to this point. Like you said, it's not linear, so I'm just so curious to know, because so many people discovered public health along the way, and you have merged two very interesting fields together, public health and law, for a power, a true superpower and a true high impact. But I'd love to learn about how you got here. So do you remember when you...
Oh God. I remember being in my second year of law school. I went to the University of Alabama, Roll Tide Roll.
Yeah.
Second year of law school, I was a full tuition scholarship student. I was a single mother when I was in law school. I started law school the day my daughter started kindergarten, it was very planned. But the second year, I was like, I don't want to be a lawyer. This is not how y'all depict it on TV. There's a lot of reading and writing and not as much stage time as I thought I would get. But I remember a professor, Professor Fair, said to me, a bunch of really smart folks sat around a table and thought that you could have a career in law. And I want you to think about this as the highest liberal arts degree you can get. You can do anything with a law degree. Just finish this degree. And then I listened to his advice and stayed in school. It felt like smart advice despite how I was feeling emotionally. And then a friend of mine who was in law school at the University of Maryland said there's this thing called the Presidential Management Internship that you should have your dean nominate you for. And so I took that information to my dean, and my dean was like, I've never heard of this, but okay, let's get you nominated. And so I was nominated to be at the time, a PMI, call them PMFs now, Presidential Management Fellows. And I was a finalist. Once you go through the interview process, I became a finalist, and I got offers from the Securities and Exchange Commission, the Department of Education. I got an offer from the Department of Housing and Urban Development. One would have had me in Dallas, Texas, DC, Greensboro, North Carolina. But I chose CDC because my parents had been in the Army and they retired from the Army at Fort Gordon, Georgia in Augusta, which was 2 hours outside of Atlanta. So it was close, but not too close to them. And I couldn't even spell public health. As a single mother, I had obviously taken advantage of public health services, but public health is invisible. And during my growing up era, it was invisible. It wasn't even an option for a field, right? I get to this agency full of scientists. I'm at that time assigned to the financial management office, and I'm on the congressional legislative team. So I basically plan visits for congressmen and women when they want to come to CDC. And I was miserable. My first 6, 8 months at the agency were miserable because I didn't understand how somebody trained in the law could add value in an agency full of scientists. I didn't understand public health. And then 9/11 happened, and I was asked to work in the Emergency Operations Center as an operations analyst. And I manned a desk where states were calling in if they had either a threat of an anthrax attack or had experienced some sort of anthrax situation. And I began to realize, state law plays a role here. And it began to start to become clear to me that there is no public health in this country without the law. Law is the foundation of the work that we do, especially in governmental public health. And law is a huge intervention. Yes, scientific insight matters, but it's when you couple that scientific insight with legal might that you actually see changes in population health, changes in the system. And that's where public health thrives. And so when that light bulb went off, I kind of felt like, this is how I can help this field. But even then, I was still like, okay, I'm going to do my 2 years as a PMF, and then I'm going to go be a real lawyer. And it took mentors. It took people who knew public health, who had passion for public health, to say to me, there is a role for you here. Just keep going. Just figure out how your education and your background connects. Find those issues that you're passionate about. And they were right. My mentors are right. And so 24 plus years later, I'm now a public health lawyer. And along the way, I got an MPH, which kind of grounded how I applied my legal skills. I tell folks now when I do my coaching, if you've got a law degree, but you find yourself interested in a particular field, think about what it may look like to get a master's in that field so that you can better understand the business to which you want to apply your legal education. Not necessary. If you can get somebody to pay for it, certainly doesn't hurt. And that has definitely changed the trajectory of my career for sure.
Yes, I love that. I love that story. I think that as you were, like you said, you're going through it, you couldn't see how it connected or any impact. But of course, retrospectively, looking back, you couldn't have planned it better, I would imagine, right?
Yeah. Definitely God. I can see it very
Yeah.
clearly. The
Yeah.
people that he was placing, the opportunities that were given to me, even in the midst of being frustrated often around it. God was like, no, just keep going. Just keep going. Just keep going.
Perfect mentors right
Yes.
there.
Yes.
Wonderful. So let's talk a little bit more about now, like what you're doing now. Tell me again, because you've got a couple different hats.
I do. Okay, all my hats. Let's see. Well, my major hat is serving as director of the National Coordinating Center for Public Health Training, which sits in the National Network of Public Health Institutes. And there we work primarily with our Public Health Institute partners. There's 40 plus public health institutes in states across the country. We work with public health training centers, a wide variety of contractors and partners. And one of the major projects I work on is the Public Health Infrastructure Grant. I serve as the co-PI, and MPHI is one of the national partners on the Public Health Infrastructure Grant. Key piece of that work is advancing the public health workforce. And so it kind of makes sense that work sits largely in my portfolio. We do a lot of training and technical assistance for the funded health departments as a part of the Public Health Infrastructure Grant. I also do quite a bit of belonging strategy. I do have a certification in diversity, equity, and inclusion. I'm a certified belonging strategist and belonging coach. And when I work with one-on-one clients, it really looks like helping them understand that a sense of belonging is something that you've got to create for yourself. If I had waited for the field of public health to create a sense of belonging for some weird person with a law degree, I don't know that I would have advanced in my career as I've done. It took being intentional about finding those mentors and working with those people and finding my community in the field. And sometimes in spaces where I was the only Black woman, the only Black person, or the only Black woman, I might make friends with the secretary or the administrative official so that I'd have somebody to hug on me, to cover me in those moments of frustration. It was through that cultivating my own sense of belonging in the field that I've been able to really kind of maintain space here. I help my clients really build a plan to move like they belong in the spaces that they feel called to, because that's kind of what I've had to do throughout my career. When I work with organizations and leaders, my goal is to teach them belonging-based leadership principles so that everybody can thrive. We're all concerned about reducing health disparities. We're all still concerned about health equity in this field. But we're not going to reach our health equity goals. We're not going to reach our goals of reducing health disparities if the people that are doing this work don't feel seen and valued and heard in this work. If we don't recognize that so much of the people that work in public health come to public health because of their personal experiences, their lived experiences with their families and themselves. And it's not just the scientific expertise that moves this field. It is those lived experiences. We want to know the science and the theory so that we can change the lived experiences for people who look like us, who have been through those things. And so we've got to move like we know we belong, but organizations have to create spaces where lived experiences are viewed as expertise, where we can show up as our authentic selves in this work, where there's room for us to call out that things like racism and sexism, all of the isms, ableism, that they impact our work in public health. But all of us, no matter where we come from, our background, our expertise, our ethnicity, our religion, we all have this human need to belong. And that's how things move forward. That's how we grow. We know it matters in our work in public health, but to us as individual human being. And I'll tell you, the moment that light bulb went off for me when I was doing training and workforce development at CDC, we can do all of the training, all of the workforce development that we want to do. But if people do not feel that they can be seen in this work, we're not going to be able to keep them. I think DEI asked the question, can you get them? And we can get them in public health. We have a very diverse field, but can you keep them? Can you advance them? Can you promote them? And those are the questions that belonging asks of our field and of others. And it's a key piece of my work. I think the scientific expertise matters, but the humanity of this work, we got to bring the people back to public health.
I absolutely love what you're saying. And what it reminds me of is a conversation, kind of an ongoing conversation that I've been having where, this year, so we're recording this at the end of 2025 to put into context. And this has been one of the most challenging years for public health, right? With it feels like we've been the intention to dismantle public health and the gutting out and the shock of it all and how we were initially trying to prepare ourselves for what was coming and then realize that we were not prepared for what was coming and just really being in shock like first quarter or so of the year. And then I remember getting to about somewhere around May, and I had a conversation actually with my therapist, and I'm talking about what's going on. And she said, what you're describing feels like a personal, like you've been traumatized. And yes. And what when you say that this is, a lot of us are in this field because it's personal, it's our lived experience. So for a lot of us, it has been traumatized. It's impossible not to take it as a personal attack because we're so personally invested in our work and in this field. So it's also refreshing to hear you describe belonging principles. And it's also great to know that that is continually being embraced because we know that in a lot of places, so much has been dismantled, but it's refreshing and encouraging to know that that's still being embraced.
It might be the safe area right now, right?
Yeah.
People are afraid to say DEI, little less afraid to say belonging,
Right.
right? It lands a little softer. But when you start looking at the science of belonging, you begin to recognize the importance of it, not just for us as individuals, not just for marginalized people, but for all of us. And there's science behind it. You see a 56% increase in performance when people feel like they belong. And imagine that in public health, a 56% increase in performance in the work that we do is huge, right? So yeah, it absolutely matters.
Oh, that's wonderful. Wonderful, wonderful. I would love to I don't know how much you can say about the Public Health Infrastructure Grant, but I would love to know you have a very unique lens because you're a lawyer, legal expert, and you have this public health lens. So I am familiar with the Public Health Infrastructure Grant. Some of my clients and the organizations that I serve are funded, by that grant. So we've heard so much about what's lost. Can you speak much to how any of the changes in this year have impacted that grant or the programs that it's funding and how organizations are trying to pivot or address, some of these shifts from major sources like that? Because that impacts not only their workforce, but everything they do in the communities they serve.
Yeah. So in many instances, I feel like what we're seeing happening is, for lack of better words, is dismantling the very infrastructure that we're being asked to improve with the Public Health Infrastructure Grant. But I got to be honest with myself, and I've asked other public health practitioners, was our system of public health so good before? Right? Part of the reason we have the public health infrastructure grant is because we knew we needed to make improvements. And I'm not saying that the dismantling that's happening is good. I'm not saying that at all. But the lens through which I've been encouraging us all to think about it is if we could rebuild public health in a way that really mattered, if we could reimagine a new public health system, this is our opportunity, for better or for worse, to do that, to really think about what do we need to actually reduce health disparities. There's so many areas of this. We've been doing this work for 20 some odd years. So many areas where we've not seen the types of change that we know are possible because the foundation and the infrastructure wasn't there. And I think that we have an opportunity, if I'm trying to think about it through a positive lens, we have an opportunity to reimagine what public health can look like. One of the things that we are doing now as a part of the Public Health Infrastructure Grant is some health systems change thinking, looking at working with a futurist to imagine what public health is going to look like on the other side of this. I've had conversations with other leaders like, it's going to take us 20 years to fix all of what's happening right now. It might, but let's not just be anecdotal about that. Like, let's sit down and really focus on what we want to see in new public health, what it's looking like, and then collectively do the work to see what we can do to make that happen. What I've seen on the public health infrastructure grant side, obviously it's federal funding, so we've got to be aligned with the federal government, with the administration's priorities. And that has shifted some of the work that we've had been asked to do with the Public Health Infrastructure Grant. There are limitations on the work that we can do around equity. There are limitations around diversifying leadership in public health based on the language. But it doesn't mean that work can't still get done. I think we've got to be creative. I think we've got to think through a lens of the future. What do we want the future of public health to look like? I think we've got to be a little more collaborative and work across disciplines. I think for people who work in public health, and I'm seeing this as one of the effects that we're seeing, is that governmental public health on the state and local level, nonprofit public health, folks are losing their jobs. When the funding dwindles up, folks begin to lose their jobs. And so folks that are working in state and local public health are really having to ask themselves, where else can I go with this degree and this background to make this kind of money, right? Or to make any kind of money, to have a career, to have a job. And I'm telling folks, public health is a mindset. It's a mindset, and it's needed everywhere. And this might be the opportunity for us to infiltrate in places that we haven't infiltrated before. An opportunity for us to take public health principles to folks that might not have been thinking through the lens of public health, or might not even recognizing they're doing work that touches public health. And so now is an era, even in this public health infrastructure grant, where it's got to be substance over form. Substance over the form. The way we used to do it, the form in which we used to do it, ain't going to be like that no more. But what's the substance of the work? And how can we think creatively and collaboratively and through an abundance mindset, right? To not only keep the work moving, but honestly, for me, to keep space for the people who are getting public health degrees right now. space. We've got to keep these spaces alive for these folks in 5, 10, 15, 20 years from now. So they have some place to go. So if they are forced to go work for a place that's not particularly known for public health, but they get to apply public health principles there, they can bring what they learned in those places they infiltrated back to us when we start to rebuild this field up again. And it feels aspirational as I say those words out loud, but that's the way we have to think about it, or we'll feel defeated. And when you feel defeated, you don't move.
Right, right. No, I completely agree with you. And now I'm curious to know your thoughts. So because my little innovative mind has come up with what I feel is something I can pour myself into. Because I've heard a lot of we're aware of things that were our weaknesses, like what we did wrong, what we would do differently, right? In two areas. One is, of course, these cross collaborations, interdisciplinary connections and the power. Like, I've said that for a long time because my background is so diverse. So I came from healthcare, I worked in government, I worked in commercial industry, and then started consulting. And I don't feel like I spent my time trying to transition from one to the other. But then, of course, the last 8 or so years, I realized it's all of that that breaks, the skill set that I bring into any consulting project. So more of these interdisciplinary relationships. But even before that, so what I'm pouring myself into is this breakdown of communication, right? So I have also said this a whole lot before. It didn't matter as much now as it does back then as it does now. When we are able to communicate public health, what it means, those intersectionalities in plain language to our communities, our friends, family, they really understand what we do through the lens of which we operate. So for me as an epidemiologist by trade, I could go through that lens. You can explain it from the legal view. But when our friends and family are able to really understand public health, plain language from our regular conversations, right? And they're starting to get that, we get more community buy-in. So people are going to automatically start connecting the dots themselves. They're going to start going to, if we get more community buy-in for public health because they're really understanding it, then we've got a bigger movement in our legislative our lawmakers, and when they want to hear the stories, and they're not going to as easily be able to remove us if the community is bought into this and they understand it, right? So I started this series on the podcast, What is Public Health? Really generating the conversation to get the story, a collection of stories. How are we explaining it in plain language? Now, it doesn't mean that on these episodes, these little special conversations, that we've figured it all out, because honestly, we're learning how much we don't have figured out, but we're having the conversation and they're getting better and better and better. It's getting a little momentum. But I really feel like that is creating what was missing before. And if, I'm just leveraging my podcast. This is 8-year-old platform and a very loyal audience of listeners, and everybody's feeling like, what can we do? And some people are going to be all on board with it and others are going to pick up a little later. But I feel like this is something that we can do. We can start to get the momentum forward, have this collection of stories where anyone can access them and start to understand. And we're practicing in real time these, how we're communicating, and hopefully having better conversations at the holiday gathering with the family or the walk with the neighbor. What are your thoughts on that?
I mean, immediately I think to myself, we got to start, we all, myself included, need to be walking into elementary schools. We need to be talking about describing public health in elementary schools. I keep going back to, we wear seatbelts as adults, many of us now, because our children were like, where's your seatbelt? Like, the target of that communication was children who then told us what to do, and we were wearing the seatbelts, and now it's a part of our system. But it was that educating of the children. I think now we have an opportunity. We talk about it in our work, this pipeline, right? Creating a pipeline of folks going as deep as first, second grade, and letting people know that these careers exist. Because a lot of times I'm talking to coaching clients who, I wanted to be a medical doctor, and then I found public health my senior year of undergrad, right? We need to be, these children will then talk to their parents and their families. And yes, I think those conversations, we need to be having those conversations with our families. But I don't know about you, my folks, you're talking from an educated lens. That's your education. That's, I think there's something about just simply defining public health, characterizing it for young folks, and they can spread that message probably better than we can. That's what comes to mind to me as you talk about communication. The other thing that I think is critical is not talking to each other, right? I do think I said this to a class last week around us doing a better job of defining and characterizing public health for our friends and families, for calling out where public health has led to a solution, or where public health making public health more visible to the people around us, because those are the people that are within our close circle that we see regularly. We do have a responsibility for doing that, but there's just something about getting into the brains of the young folks. And I, as someone who again came into public health with a law degree, I was suspicious of public health. I felt my first couple years in public health, I was like, "Oh, y'all just gonna take our ice cream off the shelves. Y'all just gonna take everything away from us." And I remember being in MPH school, and one of my MPH colleagues was like, "Yeah, because Americans don't know any better." Well, teach us better. Teach us better. Right? So I think this idea of having these conversations, the communication, meeting people where their values are, because we all, whether we can articulate it in a way that makes some sense, we all value public health when we break down what public health is, how it protects all of us. The other key piece for me in my communications is just, I work for the people. My job is about people. We call it public health, and I have an MPH now, but my job is about the people. It's about protecting people, about doing the work to ensure that the environments that they live, learn, work, and play in are safe and healthy so that they can live, learn, work, and play and worship and age, right? Like, my job is about the people. When it comes down to it, that's ultimately what it is. And I think we in public health serve ourselves better when we talk about it through the lens of people, not the systems, not the science, but the people.
Yeah, yeah. Oh, I love that so much. You've given me some ideas about the elementary school. I got a 4-year-old grandson who's he's in 4K now, so there's a lot of opportunity. And I'm even thinking, just a quick story. We had this whole conversation around when he got his flu shot, and that he had a Band-Aid that represented the fact that he had his flu shot, and he doesn't completely understand that, but he was really proud of himself. So he got his on a Friday, I got mine on a Monday, and I was telling him, grandma's gonna go get her flu shot. And I took a picture of my Band-Aid. I saw him a few days later, and I showed him the picture. I said, "Grandma got her flu shot." And he's looking at it. He's like, good job." I was like, I just like, they're a great group, and I love that you brought that up, elementary school. And I'm gonna brainstorm that one a little bit. And yeah, I love the energy around, what can we do? Yes, we're aware of the stuff that's happening, and right, it's happening at the same time. It's like, okay, well, this is something we can start to do about it.
And
And
you know what?
anyway,
Here's the other thing I want to say real quick. You can't make us disappear. You can't.
right, right.
You can't. Because none of this works without public health. It hasn't. From the days of sanitation, right? Like, none of this works without public health. As my boss, the CEO of NNPHI, says all the time, the human need is going to be there. And what I've been saying is, with everything that's happening now, it's going to be highlighted, the human need. It's going to be spotlighted. Unfortunately, there are going to be deaths and illness. The need is going to be spotlighted. So when students ask me, well, maybe I should major in something. No, ma'am, don't major in anything else. If you have an interest in majoring in this, you need to know that they're going to need you. Based on what's happening now, they're going to need you. And we, folks like us, are working to keep space for you, and to make sure that there is a field for you to come into in the next 5-10 years, for sure.
Exactly, exactly. Love this. Oh my goodness, it's been so great. I want to be cognizant of time, and I have so many other questions. I think I'm gonna have to have you back again for like a part 2
I
sometime
love
soon.
that.
As we begin to wrap up, I'll just ask, is there anything that you would like to add or say that we haven't touched on already? Just to give you an opportunity to jump in on something.
I think I've said all of my, the points that have been heavy on my mind throughout my career and recently. I want people to know there is no public health without the law. Everybody doesn't need to go necessarily get a law degree, but I do need public health people to recognize the importance of law as a social determinant of health, the importance of law as a tool in the public health practitioner's toolbox. I've worked really hard over the last 20 years or so to create tools and resources for the non-law trained public health practitioners so they can see themselves in this work. I don't want to spend a whole bunch of time wallowing on what wasn't great about our field before now. But if it's being broken down and we're gonna have to build it back up, what are the elements of the building it back up that we have to have? What is the basic foundation, and not just the words on paper, but the real basic foundation of public health? And yes, I think folks like us have been doing this work for decades. We matter in this conversation, but it's the new folks who matter in this conversation, who have that outside lens coming into the field that can tell us, okay, these are the areas where I think we may need to make some changes, particularly in this era. And I think we need to do a better job as old folks of passing the baton to the young folks, of moving out of their way to allow them to lead in this new generation. I'm in so many meetings where the over 50 set, and I'm in the over 50 set, are leading it and leading the conversation. And our vision is from 50 years ago. We need a vision that's 50 years forward. And so I think we need to do a better job. Yes, cross-disciplinary, interdisciplinary work matters, but that cross-generational work in public health, that's where the shift is going to happen. When you bring those folks with you and you've got that long-term insight coupled with new innovative ways of thinking, that's where the change happens. So that might be the thing that I didn't say that I want to say. That intergenerational work is what matters right now, critically.
Yes, that's amazing. Thank you for adding that in. Thank you for the entire conversation. It has been wonderful, uplifting, some great insights. This is definitely one. I took a lot of notes as we were talking. And I know we're going to have you back.
I'd love that. This has not been long enough at all. And when you come to St. Louis, we're definitely going to do something for sure.
Yes, absolutely. I'm looking forward to that. Thank you for being here, and we will definitely keep in touch.
Thank you so much. Have a good one.
I really hope you enjoyed that conversation as much as we did. Montrece's insights remind us that public health cannot be made to disappear because the human need will always exist. The path forward requires substance over form, thinking creatively about where public health principles can be applied beyond traditional settings, and ensuring new professionals have space to lead with fresh perspectives. Whether through plain language communication with our communities, bringing public health conversations to elementary schools, or fostering intergenerational collaboration, the work of protecting and rebuilding this field continues. Your expertise and vision matter in shaping what comes next. I encourage you to connect with Montrece and learn more about the amazing work that she's doing. You can find the links to connect with her on the show notes page. The show notes page for this episode, which is episode 439, can be found at phecpodcast.com. Once you're there, just navigate to episode 439 to find its show notes. One more thing before we go. Remember that our podcast has an app and private community where you can engage with public health professionals around the world. You can download our PHEC podcast community app in your mobile app store, and it is available to both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.